and welcome to the Renewed Nurse Podcast. We are going to talk today about nurse well-being, and this is presented to you from the WVU Medicine Center for Nursing Excellence. I'm Melanie Heuston, and I'm the Chief Nurse Executive for WVU Medicine.
Hi, my name is Allison Dempsey. I am a med-surg nurse working on 7 West at Rubin Memorial Hospital. Melanie, what have you invited me to be a part of? What is Renewed Nurse?
Well, welcome for doing this with me. I am so glad you're brave enough to come on this podcast. Renewed Nurse is an exploration of nurse well-being and the work that's being done across WVU Medicine to address the challenges that nurses face and how we can all empower nurses for well-being. Each episode, you and I are going to sit down, we're going to discuss the topics of nurse well-being, share our thoughts on what we're learning, speak with other guests, and it's not going to be just you and me, and we're going to have experts across the health system who are going to share strategies, and then we're going to learn some things along the way.
Awesome. Sounds great. I'm excited to be a part of it and learn from everyone. So.
Okay. Are you ready?
I'm ready.
All right. Let's start with some of the basics. What we understand about well-being, and I'm going to share a little bit about our story so folks get to know us, and also what we think about well-being.
Okay. As far as well-being, in my opinion, I think it's a holistic approach that encompasses social, physical, mental, all sorts of things that, you go into a patient's room and you learn from them each and every day. And I think it's not so necessarily being disease-free, but having a balance between patient care each and every day.
Well, that's great, because we as nurses care about our patients.
Right.
But what about us? We got to take care of us.
It's true.
And so we need to think about our well-being, because just like they say in an airplane, if you don't put the oxygen mask on yourself, you're not going to do a good job taking care of your patients.
Sure.
So let's talk a little bit further about, nurse well-being, and maybe if we start talking about why you became a nurse.
That's a loaded question, Melanie. Growing up, I would definitely say, I've even answered this question in my first interview with Ruby. Didn't want to be a nurse. Had no parts of it. But it was only because I was a sick child. I had a lot of autoimmune disorders. I hated being in the hospital. I was afraid of everyone, afraid of everything. But then as I grew older and matured a little bit, I realized that nurses were the ones that were providing that empathy and care to me. And I think the biggest thing that it drew me to just becoming a nurse is that I can have a direct impact on someone as soon as I walk in the door. It's 5 seconds, a smile, a handshake, hello. Having that direct impact on someone else's life with no other exterior kind of variables, it's awesome that you can be that one person to change. So.
And the way I think about what you just said is when you walk in the door, people trust you.
Right.
Immediately they tell you things that they won't tell anybody else,
Right.
And they trust that you're going to take care of them.
Right.
I think that's great. So, I kind of have a story that, a lot of people think is, cliche,
Right.
But I really did want to be a nurse my entire life. In fact, my mother took a picture of me going to kindergarten in my nurse's uniform. And I would say that has stuck with me my entire life. And, I think that every day is not perfect, but every day I'm glad I'm a nurse. So it's been great to learn a little bit about why we're nurses. So what are some of the biggest challenges that you face for nurse well-being?
Every day is a different challenge. I work typically with a geriatric population on 7 West. So we see a lot of hospice patients. There's a lot of life and death kind of situations dealing with the families. But there's also a lot of issues when it comes to your own self well-being and time management, taking 5 minutes out of the day to prioritize yourself. Back to the diabetes situation, I quite literally will mute my own Dexcom alarm to give someone else insulin, right? So that kind of defeats the purpose. I think just taking time for yourself is one of the biggest parts, and learning how to balance your home life and your work life, and doing that throughout the day, and not having a grueling 12-hour shift, but being able to kind of focus on yourself.
Well, taking care of patients for 12 hours is really hard work.
It's a long time, yeah.
And we're going to talk a little bit further about how we're going to do some of these things as we move along. Some of the things I find challenging for well-being for me are a little different, right? I'm a little older than you. I've been a nurse a lot longer than you. And I'm not taking care of patients on the front line.
Right.
But what I could tell you, being a little older, the challenges I face are staying proactive with my health care, worrying about my aging parents, worrying about my adult children and what they're doing. Mm-hmm. And so, you know, those are the things I'm facing now. But when I was younger, I was a single parent for many, many years. My husband died when my children were very young. And so I can relate to some of the things that people are going through, how hard it is to take care of patients and take 5 minutes away. Mm-hmm. But as I've gotten older, the challenges change. So how do you incorporate some of these well-being into your workplace?
I think that every day is different, for sure. I would like to say that, you know, I take a half an hour out of my day and sit down, relax, you know, eat a well-balanced lunch. That's not the case. Right. Some days I don't even pack my lunch because I'm running late anyways. But realistically, you know, I take 10, 15 minutes, walk down to Starbucks, whether or not I get a coffee or not, but I look out the window and just realize that, you know, the work is going to be there when I come back. The patients are still going to be there. And we have a lot of resources and a lot of staff members that are willing to help each other. So I think just taking time away from the floor for just a few minutes, 10, 15 minutes. And I also, you know, I like to prioritize just sitting and acknowledging that I have my own boundaries and just being true to myself, and not being afraid to ask for help. So
that's big. I think that's big for everyone.
Yeah, I think that's one of the hardest things is I like to do things on my own and I like to get the job done knowing that I've done everything I can, but sometimes you can't be in 6 patients' rooms at one time. You have to ask for help. So knowing that's available.
That's one of the reasons we're doing this podcast, right? Because these problems are universal, right? And we've got to figure out ways to keep ourselves healthy and in a healthy state of mind. Some of the things I do is I've really prioritized exercise. I didn't do that as much when I was younger, and I wished I would have. And everyone says they don't have enough time, but you've got to make it. I really focus on eating healthy. I think that's really, really important. And balancing my personal life with my work. And that is sometimes easier than other times. Yeah. And so those are things that, you know, I work on. So are you excited about this?
I'm excited. Yeah, absolutely.
So what kind of things are we thinking about getting into?
Overall, I just want to learn about how we can incorporate wellness into day-to-day life. How I can make just one change every day for 3 days a week and see how it benefits the end of my week. I also just want to focus on what other people are doing across all hospital systems and see if there's anything that, wow, I didn't think of before. That'll definitely help me. So I'm excited to talk to other nurses, other colleagues. I know we're going to have a few guest speakers too, just to get their opinions. But overall, just learning how to balance work, home life, and just overall wellness.
Well, let me tell you what I'm excited about. Everything you just talked about and talking to nurses and colleagues across our health system. What we're doing well, and then what we still have to do, because I think we still have work to do. Well, it's been great getting to know you. Too. And I got to spend some time with you on the unit, which I'm sure we're going to talk about later. Right. Let's share with the listeners and viewers what topics we're trying to cover.
Right. So there will be 6 total episodes of Renewed Nurse. This episode obviously talked about nursing well-being and wellness. And then the next episodes, it's going to focus on using Maslow's hierarchy of needs as a framework for the rest of the episodes to kind of guide us through each one.
Well, all of you know about Maslow's hierarchy of needs. It hasn't changed from when I became a nurse 40 years ago. And so the very basics about Maslow is the physiological needs. So we're going to use that as a framework for the podcast. It's really going to talk about your physical needs as a foundation for nurse wellness. And then we're going to talk about physical wellness. We have a guest coming from Wheeling's Howard Long Wellness Center to talk with us about the importance of physical wellness and some of the innovative approaches that they're taking to create access to resources to maintain nurses and other clinicians' physical wellness.
Right, so we will meet again here next week, and Joe will be here from Howard Long.
Yeah.
Okay, awesome.
Okay. Awesome. So what are we going to talk about on episode 3?
Episode 3, we look like we're diving into just overall wellness again, and then how we're incorporating those techniques into our practice.
Well, great. I think we're going to also talk about creating space, and space and how we make space at work, physical space, space in our mind, just the whole concept of making space.
I think that's important too, because not only is there a mental space that we need to have available, where is that actual space that we can go that's not a bathroom, Starbucks, or a corner in the hallway?
Right.
So,
or the supply closet, right? And in episode 4, we're going to go further up the pyramid and discuss the importance of support physiologically, psychologically, and the well-being in the workplace. Then episode 5, we want to talk about mental health. And when I began nursing, mental health was not a topic that we talked a lot about, and the environment has changed. So we're going to talk about some of these things that, I hate to say that I'm excited, but it's really something that's necessary, and how we can help that in our day-to-day life, because that impacts our life as nurses and our family life.
Mental health is a huge thing now. It was almost a taboo topic to talk about before. Not many people brought it up, but I think since after COVID, we had that almost culture shift where everyone changed. The mindset of going into the hospital was either a scary day or something that we didn't even know how to do. So mental health is extremely important now, for sure, and I think a lot of people need to talk about it.
Yeah, I'm glad we're finally talking about it. So there's a lot of fun and a lot of dialogue to come, and after the release of the first 5 episodes, we're going to be looking for feedback on this. What type of topics do people want to hear? Any initiatives that are being done across the health system that we don't know about? Things that you liked about our podcast, things that didn't go well about our podcast. We're going to get to the potential episode of 2 and what that might mean for the future content. So what can we expect for episode 6?
Episode 6, we're going to come to a close, but we will be talking to additional guest speakers, especially about the resources that they have available and what approaches they're going to be used to, help give us access to more resources for our own staff.
Well, that's a lot of information. We've got a lot of work to do setting up our podcast for you, but we really are excited because we want to model the best practices. We got to be better too.
Okay.
And one thing we know is a great way to empower nurse well-being is through a debrief.
Okay.
And I think after a stressful day, we don't do that enough. And so you and I are always going to have a debrief after we have our podcast. And so I hope our conversation wasn't stressful today. And so I'm going to ask you, we're going to practice.
Okay.
So how are you feeling after our discussion today?
I feel good. I feel like I am able to open up to my own self about what is realistic in the things that I do and what I could do better, for sure.
So is there anything you learned today?
I learned that I immediately go to patient focus, and sometimes I need to think about myself a little bit more. So that'll be exciting to hear from other people about if they do the same thing or if I could, do a little bit better.
Well, that's a good debrief. So I didn't know that's how you were feeling, and now you know how I'm feeling. I am so excited to be with you. And with that being said, we'll see you next week, and I'll see you next week.
Right.
Thank you for listening. We really appreciate you being on this journey with us as we move forward. But really important to us is your feedback. So for inquiries, recommendations, feedback, I want you to give them to me personally. I'll share them with Allie, of course. But what I want you to do is email me and put in that line that you are giving me feedback. And here's my email. You can find me easily, but my last name is spelled unusually. So it's MELANIE.Heuston, HEUSTON, @WVUmedicine.org. Thank you so much.
Thank you.
This podcast and video presentation were brought to you by the WVU Medicine Center for Nursing Excellence. For comments, questions, or suggestions, please email melanie.heuston@wvumedicine.org with the subject heading Podcast Feedback. This program was executive produced by our Chief Nurse Executive, Melanie Heuston, and developed and produced by me, Eric Small, with the Center for Nursing Excellence. Multimedia production and recording is by Chad Atkins. Our logo was designed by Carly Kale. We want to raise a special thanks to all of our partners in the marketing department at WVU Medicine for their work on this project, and to the nurses who dedicate so much time, effort, and care for the patients of WVU Medicine. Thank you.